Hey guys, yes, you. Welcome back. Back. Back to my channel. Today we are doing ASMR, getting something out of your ears, your eyes, your face, your mouth, your nose, your scalp, and your brain. So, all of the above. Now, like always, this is going to be part of my school nurse roleplay playlist, which I will link in the description box down below, just in case you want to watch all my nurse videos. Now, with all that being said, you guys know the drill. Go ahead and sit back, relax, and most importantly, enjoy. The next student can make their way in. Hi, love. Hello. Go ahead and sit down. Make yourself comfortable. Do you know why you're in the nurse's office today? Oh, so you haven't heard the news. Well, it's not that great. Unfortunately, there's been a major outbreak at the school. Yes. The only way I can describe it is like ringworms. You know how contagious they are? Yes. This one is 10 times more contagious and harmful. Unfortunately, we have to check all the students, including their scalp, their eye, their face, their ears, their nose, their mouth, and potentially their brain. Yes, it's that severe. So before I get started with the checkup, let's go ahead and ask you a few questions. What is your first and last name for me, love? Okay. Beautiful. And what class are you in right now? Okay, thank you. And what grade is that, love? Perfect. Now, do you have an emergency contact for me? Mom, dad, grandpa, grandma, aunt, uncle? Beautiful. And what's their number or email for me, love? Okay. Perfect. Now, let's get to some of my questions, okay, love? This pertains to those ringworm-like creatures that are plaguing the hallways. Now, have you had any itchiness on your scalp? Okay. What about your eyes or your face, your nose, mouth, or ears? Okay. Now, have you been in close contact with anybody who has had some abnormalities on their face or their scalp? Okay. Now, have you noticed anything strange on your scalp? Maybe it's been very dry, or your face has been breaking out to say blurry vision, anything that could be a cause for concern. Okay. I'll have to check that. What about headaches? Any headaches? Okay. Okay. Well, so far, so good. Especially because I don't see anything strange so far. So what I'm gonna do is start from the top and work my way down. If we don't see anything, I might need to check your brain. But we'll cross that bridge when we get there. Let me go ahead and put my gloves on while you come a little bit closer for me, so I can check your scalp/hair. Okay, love? All right. I'll put these on. You just come let's go ahead and take a good look at your scalp. The worms don't really live in the hair. Like I said, it's almost like a ringworm, so it's going to be primarily on the skin. So we're just going to take a good look at the scalp. Now, do you feel this? And does it hurt? Okay, because the worms can affect, yeah, it can make it feel really tender sometimes. Anyways, let's continue to look. Good. Okay, now, I'm just going to take some scalp flakes, and inspect them even closer. You have a lot of hair, so sometimes it's a little hard to see. If I see any weird patterns, I know you got the worms. Anyways, let's go ahead and beautiful. Nothing. Just going to nothing right here. It was a little flaky up front. Ooh. Is that movement? Oh, I see legs. Worms don't have legs. But you know what do have legs? Lice. Now, in any other occasion, I would freak out. I don't know if you know this, but I'm kind of like the lice queen. Anyways, but since there's a major worm outbreak and it's a big time, I'll have to handle it another time. Assuming it is lice. Let me just check really quick. I'm just going to go. Ooh. Yeah, you got a few of those bad boys in there. But you know what? It's a problem for another time. I'm gonna go ahead and check your eyes and your face. Maybe I'll have time to do a lice check next week. So if you don't mind just moving in front of me, that way I can get a good look at your eyes and your face. Just go ahead and beautiful love. Thank you for going back. Now, we checked your scalp and your scalp looks beautiful. Let's check your face. Are you ready for a little test before I take a closer look? Okay, beautiful love. We're going to do a dull or sharp test. Just like when I was squeezing on your scalp to make sure you weren't feeling any pain, I want to make sure there aren't any sensitive areas in your face as well, okay? Alright, so you let me know if it hurts as well. Alright, go ahead and close your eyes. Beautiful love. And I'm just going to poke. Was that sharp or dull? Wonderful. Now right here. Poke. Was that sharp or dull? Beautiful. A couple more. Poke. Sharp or dull? Beautiful. Poke. Sharp or dull? Wonderful. Now, let's take a close, in-depth look at your face. See if there's any scarring or anything like that. So we're just going to look at your forehead. Okay. Look at your eyes. I'll take a closer look at that later. Your cheeks. is not a typical cause for concern, but unfortunately, with these worms, they can cause you to break out in hives. So I do have to pop that blemish and see what color the pus is. If it's green, you might have a case of the worms, but if it's white or maybe even a little yellow, I know it's kind of gross to talk about, it's just a normal pimple. So let's go ahead and take the proper precautions and swipe that area off first. Just a little disinfectant. Just gonna take a little stipple. We'll get that off of your face really quickly and hopefully pain-free. So we're just going to swipe. Beautiful. And I'm just gonna pop this, okay, love? Okay. Now, let's take a look at that pus. I know it's gross, but we have to do our job. Swipe. Oh, thank goodness. It's white, not green, so we're still in the clear. All right, love, your scalp and your face look great. Of course, there is that little blemish, but it'll heal in a couple of days. Now, let's do an eye test and take a closer look at it, okay? All right, so follow this purple light. It's a little hard to see, but that just makes it more difficult. I need to make sure there are no worms in there. Yes. So follow. And a little bit faster. Follow. Zip. Beautiful. Now, how many fingers am I holding up? Good. And what about now? Perfect. And which hand is closer? Good. And what about now? Perfect. And what about now? I know it's a tricky one. Okay. Now, let's take a closer look at that eye. Go ahead and close this one for me. Thank you, love. Just going to look up for me. Good. Look down. Uh-oh. Okay. Maybe you have something going on in your eye. Do you wear contacts? You do. Okay, well, close this eye and open this one for me, love. Thank you. Look up and look down. Good. Roll your eye around. Roll. Now, close this one and open this one back up. Look up and look down. Okay, so here's the deal, love. I don't see what I see in this eye, which means there is an abnormality. Now, let's just try to lubricate your eye. Get my cotton swab in there. Take it out. If it doesn't come out, then we'll talk about that later. If it doesn't come out. Now, go ahead and close your eyes just to get them nice and moist, and I'll add a little bit of water if that doesn't work. So just close. Beautiful, love. Now, are your eyes still a little dry? Alright, a little bit of this. Beautiful. Now roll your eyes around. this thing out. We're just going to swipe, 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 swipe. Oh, it looks like I got it to move, which is a great sign. Now, hopefully when I get it out of your eye, it's not still moving. That would be an even better sign. Oh, don't freak out, don't freak out. Just keep your eyes nice and wide for me. Thanks, love. All right, I'm just gonna swipe, 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 swipe. Oh, I think I got it. Yep, I definitely did. And it's not alive, which is wonderful. Okay, your eyes are good to go. Now, let's work our way to your ears. We'll do a quick hearing test, and if we need to take a look into your ears and possibly do some worm searching, we will. So, let me know when you stop hearing my hands. Oh, that was pretty quick. Let's try this again. Again, so early. One more test, love. Just let me know which side, your left or your right, you hear the sound in, okay? Alright. Wrong. Okay, you know what? Let me just take a closer look into your ears, love. Hopefully they're not covered with worms. Alright, we're just going to take a look. And another look. Okay. I see what the problem is, love. You got a bunch of gunk in your ears. I have to clean it out, and I'll look for any signs of worms while I clean it out, and then we can do the hearing test. So go ahead and turn for me. Thank you, love. Thank you, thank you, thank you. Oh my, it's even worse up close, love. Yes, yes, yes. I mean, you got earwax blocking your whole entire ear, and I cannot see if you have worms or not, which is the real problem. So let's go ahead and take all of this earwax out. We're just going to one chunk. Beautiful, beautiful, beautiful. Let's keep digging, digging, digging. Alright, now, oh, love, this ear is terrible. You actually have some blood in here too. What is really bad about this blood is that imagine if this is from the worms. So I have to pluck it out diligently and dissect it. I'll definitely take this for testing. You never know what you could have. And I believe I see one more glob right here. Stay still for me, love. Just going to look at that, love. I know it's crazy, but the good thing is I don't see any worms, so we can move on to the other ear. Go ahead and turn for me. Oh, and let me get my light. Beautiful, 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 love. Now, like I said, your ears were a mess, but I think one was better than the other. Yes, yes, yes. This one is not that bad, not that bad, but I do have to clean it out in order to look at the skin of the ear, make sure there are no worms. So let me grab my tweezers and let's begin plucking, this one right here. Oh, it's a little sticky. Let me get my oil. And let's work it on there. Stipple, 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 stipple. Beautiful, 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 yes. Alright, I see it's coming loose already. So we're just going to nice and easy, perfect. Now, a little earwax is okay, but we don't want too much. Now let me look at the skin. Okay, I see no worms, which is amazing. Now, let's move straight to your nose. Go ahead and tilt up for me. Beautiful. Thank you, love, for lifting up. Now, let's look for those worms. Oh, love, I cannot even see your whole nostril. You got what I think are boogies right here. Yes, yes, yes. Let me see if I could just pick at it. Does that hurt? Good. And let me see if I can take this boogie out. Let me get my tweezers. And let's go ahead and pluck. Perfect. Now, let me go ahead and look and make sure your whole nostril is nice and clean before I move on to the next one. Okay, I don't see anything going on with the skin of your nostril. Let me move to the other one. Alright, now let's take a look at this side. This side is crystal clear, and I don't see any worms, which is amazing. Alright, love, you can go ahead and put your head down and we'll do a hearing test and a smell test, okay? Alright, just go ahead and put it down. Beautiful, love. Now, let's go ahead and perform that test on your ears. I didn't forget about it, and your nose, just to make sure you are 100% in the clear before we move on to your mouth. Now, we checked majority of everything, so it looks like you don't have worms, but you never know. We still have to check your brain, and usually that is the first place they're at, but I don't like to check it unless we have to. It's extremely invasive, as you can imagine. Now, your hearing test. Tell me when you stop hearing my hands. That's more like it. Now, left or right side? Left or right side? You ready, love? Beautiful. No. It's not a trick. You definitely hear it in both. Now, what about now? Good. Wonderful. Yes. Both. Now, smell test. I added a few drops of essential oil in this. What does it smell like? Take it all in. Now, which one is that? Lavender, yes. Now, this one is a little bit stronger, so just let me know when you have a guess, okay? Oh, got it. What do you Scrape, scrape, scrape. Perfect. Alright, love. I'm pretty sure you want your tongue back now, huh? I know. Anyways, here it is. Perfect. Now, let's do a quick taste test. What does this taste like? Stipple, 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 stipple. Banana. Perfect. Now, what does this taste like? The worms can affect your sense of taste, so if you can pick these two out, that's a great sign. Stipple, 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 stipple. Well, smack it around a little bit. Any guesses? Orange. That's exactly it. Okay, now you aced every test so far, but there's still one. I have to check your brain. Usually I don't get this far. Usually I see worms by now, and I don't have to dig this deep, but you just close your mouth. It'll be painless. You almost won't remember it, and I'll just pop your brain out, okay? Alright, so I'm just going to... Now, love, do you feel anything? Right. That's probably because your brain is gone. But look at this. Now, it's not worms. I just wanted to say thank you. Thank you. Thank you. Thank you so much for making it to the end. It really does mean a lot to me when you watch all the way through. I also wanted to say, if you guys like this video, do not be afraid to hit like, subscribe if you want to see more from me, and turn on your post notification bell. That way you are posted every time, or I usually do this every time I post, of course. Last but not least, I want to shout out my Patreon. I post up to four exclusive ASMR videos on there each and every month. So if you have the means to, and you would like to support the channel, the link to my Patreon will be in the description box down below. Now, with all that being said, you know I love you to the moon